All right. So this question is about a 55-year-old patient that was diagnosed with atherosclerosis while hospitalized. They are sedentary, have a high-stress job, and have a diet high in saturated fats. As part of a comprehensive medical plan to manage and reduce disease progression, which of the following lifestyle changes should be emphasized? Is it A, not relying on weight as the primary measure of health, but overall cardiovascular health? B, recommend an incremental increase in physical activity, starting with stuff like walking and working your way up. C, adherence to a heart-healthy diet rich in fruits, vegetables, whole grain, lean proteins, while eliminating saturated fats and cholesterol. D, counsel on stress management and incorporating relaxation techniques into daily activities. Is it D, smoking cessation, if applicable, and avoid exposure to secondary smoke? Or is it F, suggest regular monitoring of blood pressure and cholesterol levels with follow-up appointments to assess cardiovascular health? So which of these should you emphasize to your patient if you could only emphasize one? Okay, so that is a really great question because a lot of these are actually helpful. All right, so focusing on overall cardiovascular health, not just your weight, that one is less meaningful, especially as you get older. Not a bad one, but definitely not the most helpful. B, incremental increase in physical activity. Yeah, any sort of change, you start small, you work your way up, right? So what's a small improvement over what you're doing right now? Well, I could walk, I could take the stairs instead of the elevator at work. All right, and so you do that for a week. Hey, that's a small little increase, so what? Well, it's a difference, it's an improvement, it's better than what you were doing. All right, now I'm going to, on my lunch break, I'm going to walk. I'm going to walk on my lunch break instead of sit at my desk. That's a small little win, but you keep doing those and it's gonna add up. Okay, next thing we talked about is a heart-healthy diet. And so it sounds good, heart-healthy diet, but how effective is it? And how likely is it that your patient's going to do it? And so that doesn't seem to be as helpful as being physically active. And so they're going to recommend, once again, the incremental increase over top of that heart-healthy diet. The American Heart Association actually has come out and said that low cholesterol doesn't really seem to improve cardiovascular health. Okay, relaxation. Stress is a killer, but it's not as big of a killer as fast food and a lack of physical activity. So it's not as high up on this list. All right, smoking cessation. Well, this patient doesn't smoke. All right, now if they did smoke, that'd be way up there on that list. Smoking cessation, but this patient does not smoke. Next thing we got is monitoring of blood pressure and cholesterol. The patient doesn't need to know about that. The doctor's going to do that all for him without you saying a thing. So the big thing is to get him moving. What can he do right now that would be an improvement? So we start him walking. And guess what? It's going to be a lot easier to encourage him to change his diet. For one thing, each healthy thing you do makes it easier to do something else healthy.